So that was a 5-second clip, and in that 5 seconds, we've had 2.41 million messages that have gone out in India, across the globe. We've had 11.5 million emails that have been exchanged across the globe. We have 275 billion Facebook posts that have just taken place in the last 5 seconds. We have had 315 billion Google searches that have taken place in the last 5 seconds. And 28,500 applications that have been downloaded. But as far as healthcare is concerned, unfortunately, we have no such statistics to report. The statistics that we have today is that 70% of India's healthcare is concentrated in 20 cities of India. We have 50% of India which has to travel over 100 kilometers just to get basic quality healthcare. The other statistics that we have to live with is that 15% of the heart attack cases die because of late arrival at the hospital. Add to this, we have 1.8 million people who die due to heart diseases every year, and again, a large percentage of them due to late arrival at the hospital. So where is the opportunity, right? If you look at the opportunity map today, India today offers 1.1 bed for every 1,000 population, whereas the global average is 2.7. In terms of a caregiver ratio, we have 0.7 doctors and 1.5 nurses for every 1,000 population versus the global average of 2.5. And here's the alarming fact. What do we need to try and get to the global average? We need 1.54 million doctors and 2.4 million nurses just to reach the global average. A task that is impossible to achieve, even if we go and build educational institutions, hospital centers, and everything that we want to do as quickly as possible. But let's add one more thing to this. The life expectancy, which was about 66 years in 2014, is going to be 80 years by 2034. So what does that mean? Focus on the numbers. 0.7 doctors, 1.3 nurses, and 1.1 hospital beds is what we have today. What we need in the next 20 years is 2.5 doctors, 5 nurses, because the biggest gap is not the physical infrastructure, if you see in all of this, it is actually the skilled professionals that is not available. So irrespective of how many hospitals, you can pump in billions of dollars in building more and more hospitals, but the quality healthcare givers, and as Alex was talking about telemedicine, the quality health giver gap is just getting wider and wider and wider. So how do we solve this problem? It has to be through use of technology. So I'm going to break this up into 2 parts. Technology on how we serve the patients, and technology on how caregivers can try and use it more effectively. So if you look at the wellness side of it, so 4 buckets on the patient side: wellness, prevention, diagnosis, and treatment. On the wellness side, it would be worth focusing on healthy living, content, obesity management, diabetes management, elder care, patient care, pregnancy tips, so on and so forth. So it's a lot more content related, because today mobile users, another statistic, which sorry is not on the slide, is the global data shows that 80% of the mobile phone users today touch their phone first thing when they wake up in the morning and the last thing when they go to sleep at night. Right? So that's a statistic that you've got to understand, that that's a device that they love more than anybody else in the world. Right? So how do we use this device for more effective care? For prevention, you've got a lot of people who are tracking and sort of who are working on this today, and India's got a slew of startups which are moving in this space on promoting healthcare trackers, on health checkups through virtual health checkups, home patient monitoring, health reports and health alerts, which can be actually given to a patient on their mobile, guiding them for better healthcare management. On the diagnosis side, I'm not going to spend more time on this because I think Alex spent a lot of time on telling you about telemedicine. I think telemedicine has been, or video consult has been something that people have very invariably said it is not worked, it's not going to work. I think yes, it has not worked because the infrastructure was not there. Today that infrastructure exists. It exists, and India is the fastest growing smartphone market and mobile data market in the world today. In the next 2 years, you're going to have 350 million smartphone users in this country. Today, a vegetable vendor walks around with a smartphone and actually has a WhatsApp on it and uses it for Paytm transaction. I think that's a huge transition that India has done in the last, I would say, 1 year. The other thing is to use technology to try and assist patients through creating healthcare centers, helpline centers. So you've got the data which is coming in from the patient. Use that data to try and see whether you can serve the primary healthcare instead of having to get them to come to the hospital to seek primary healthcare. And then the use of healthcare technology for treatment. A lot of hospitals who we've been meeting with have got very good EMR and EHR technology. They have all the patient records, but it's just sitting in servers. How do you use that EHR, PHR information and try and make that technology platform, make healthcare industry a far more interactive, a far more sort of wider reaching platform? PHR will play a very, very big role in helping clinical analytic tools. And this is something that will integrate, if you integrate this with video consult, you're talking about a doctor who can today sit in Delhi and actually treat a patient sitting in Raipur, because he can see the entire patient record, he can see the EHR, he can see the PHR, he can see everything, and at least extend that primary health care. So this is very, very important. An IPD patient today comes to Delhi, Bombay, Chennai, Bangalore, and they travel over 400, 500 kilometers for these surgeries. For their follow-ups, if we can try and avoid them to come into these centers using technology, it would be a huge breakthrough for us. And then the use of technology to connect with the hospital. So where can the hospitals play a role? In terms of emergency and trauma response, I think we talked about the fact that there is this huge gap in the hospitals not being able to respond on time. EHR and PHR can actually help in assisting paramedics in delivering very targeted medical intervention today. If you have today a paramedic who comes to let's say you call for an ambulance today, they come to you, invariably they're coming in cold and they go through a triage process of 10 steps that they've been trained to do. But if you have a paramedic system and a paramedic process which has got EHR, PHR integrated into it, a paramedic before they leave the hospital can actually start carrying all the equipment that they need, which is necessary for your targeted medical intervention. You're talking about, on an average basis, that crunching time down from, let's say, 2 hours of care delivery, critical care delivery timeline, maybe down to half an hour, 40 minutes. And instead of giving you a triage process, you're doing a targeted medical intervention. Technology in emergency response will also aid, I think as Alex was talking about in terms of video consult, will also aid in bringing in a network sort of infrastructure in providing emergency and trauma care. So you may have an incident which is happening in the remote parts of India, but through video consult, through technology, you can have doctors participating from Chennai, from Delhi, from Bangalore in assisting the paramedics or the healthcare givers on ground. So in terms of a caregiver support, I think again, viewing real-time monitoring data, doctors today can start using data to assist in delivering care to a patient in their homes. They do not need to sort of bring them into the hospitals. And last, most important, this is a terminology that we believe is going to be the big game changer in digital technology. If you can use digital technology to extend this service and extend this as a process in your hospital infrastructure, you can actually engage a patient when they leave the four walls of your hospital. This includes an integrated home support, things like labs, things like diagnostics, things like e-pharmacy. All of these will play a very big role in patient care continuum. Shifting the point of care is again another important part in delivering patient care. So if you're looking at, for example, IPD patients typically, after their discharge process, are required to come back for follow-ups, etc. If you can use technology there again in assisting them with home care options, it will help reduce the stress on the hospitals. Mobile health, again, reduces the stress on the caregivers because you can focus on technology bringing in those patients who really require the four walls of the hospital and keep the others out using artificial intelligence, using healthcare, helplines, and so on and so forth. And then you've got the preventive care. If we can combine all of this, data shows that in the next 5 years, years, we can give 340 million Indians quality health care. This is in addition to the data that is there today. To break a few myths about digital health, the first thing that we've come across is that people don't want to use digital healthcare platforms. This is not true. A global McKinsey report has shown that 75% of the respondents across the globe actually want to use digital healthcare. There is no platform for them to go to. The second myth is that it's only the young and the tech savvy who actually are looking for it. That is not true. And as you can see, a lot of us around this room, we are not young and tech savvy only, and we all seek medical health care through technology, and we're discussing it here today. So what are the 5 things that are required for extending this digital patient experience? First, the driver needs to be the government in formulating policy, in pushing the agenda for digital health. Second, as healthcare institutions, you need to invest in it. This cannot be the third or the fourth or the fifth line item of your investment. It needs to come up in your top 2. The standardization of healthcare data is another very critical aspect of it. Today, you've got healthcare data across healthcare institutions in very disparate forms. Standardization of that data will help scale that infrastructure for hospitals. When we're talking about telemedicines, different caregivers coming to different institutions coming together, the only way they can all network together is if the healthcare data is standardized. Patient care continuum process that we talked about is going to be the critical game changer for patient loyalty. And most important is adoption. If you look at today, adoption has been the greatest game changer when it comes to digital technology. You use Ubers, you use Paytm, you use everything, but you do not hesitate in using technology anymore. So this is to try and tell you how technology has changed the world. This was the announcement of the Pope in 2005. 8 years later, same scene, same location. This was the announcement of the Pope in 2013. Okay? So please do consider pushing the healthcare agenda and look for a better healthcare process in India. Thank you very much.